Hello everybody, this is Farahati. I'm using Health Economics 6th edition by Santur and Noon. I also use a few peer-reviewed articles related to the chapter 11, the private health insurance industry. Let's start with an overview of the past few chapters. In chapter 6, you'll learn about the demand for medical insurance. You remember that we have a very pluralistic health system in the United States compared to the other high income countries that most of them they have basically single payer system. You remember that we have the highest rate of uninsured in our country, about 9% of the people currently after the Affordable Care Act, which decreased basically from 16% before the Affordable Care Act. Among those people, they have insurance. 1/3 of the people, they have government-related health insurance, and private health insurance today provides coverage to over 2/3 of the population through the employer-sponsored insurance or through the basically individually purchased coverage. And you remember there is no difference between these two because the employer is basically deducting the insurance cost from your paycheck. In chapter 8, you learn about the market analysis, and you remember that we use these characteristics to analyze the market based on these characteristics, and then we use two indexes, 4 firms and HHI, and we use the rates from the U.S. Department of Justice to determine whether an industry is working in a perfectly competitive market or in the other extreme side of the spectrum, whether there is a market power or there is a basically the market is in intermediate basically has intermediate power in terms of monopolistic competition or oligopoly. So we look at these characteristics for any industry based on the number and basically market share, type of the product, and barrier to market and buyers information. We determine basically the market power in an industry. In chapter 6 and 9, we use this market analysis chart for analyzing the market. You remember, you learned about the supply and demand in more detail, basically, the graphically how perfectly competitive market determine the price and quantity compared to the monopoly. And then you learn that perfectly competitive market is the most efficient market for society as a net gain of the producers and consumers compared to the monopoly, which is the least efficient market. You also learn about the public policies, how it's affecting the market, affecting 3 elements in the market: market structure, conduct, and performance. In this lecture, you will learn about the market structure, conduct, and performance in more detail. So in this lecture, you will learn about the structure of the private health insurance industry by looking at the number, types, and size of distribution and barriers and consumers' information. And then we move to the pricing behaviors of the industry and the performance of the private health insurance industry. Starting with the brief history of the private health insurance industry, in 1929, Baylor University in Dallas began accepting insurance premiums from local school teachers to cover any medical services provided at the university hospital. Then, in Great Depression of the 1930s, hospital adopted similar financing methods basically to provide coverage for their employees. American Hospital Association created and organized several insurance plans named Blue Cross as a pro-union to allow basically free choice among the hospitals within a given city to the subscriber. And so basically, you remember that initially the premiums were determined by community rating, which means that based on the average members population. And so you remember basically in that date, American Hospital Association was enjoying a virtual monopoly position in the hospital insurance market throughout the 1930s. It is important to basically pay attention that in those days the health insurance was only for hospital insurance. So basically for hospital, because that was the main expenditure the people needed to basically have a treatment for emergency cases. Other expenditure was basically were not that significant, and there was no health insurance for the other services such as outpatient, dental, mental, or any other preventional basically services. During the World War II, hospital insurance market expanded and the level of competition intensified, and then that basically that was the time the employers tried to attract additional laborers by offering fringe benefits by including the private health insurance. So basically commercial insurance companies entered in the industry in the late 1940s, right? Before that was just basically a monopoly market. Now, we wanted to know currently what is the market power in this industry structure. Based on the structure of the private health insurance industry, we look at these characteristics one by one to determine whether the private health insurance industry enjoy the market power currently. So the number and size distribution of the private health insurance, based on that, we see that at the national level, there are a large number of the insurers with relatively small market shares. In 2010, there was 2,151 group insurers and 643 individual health insurance market. In 2009, the largest health insurers in terms of revenue were this list. The biggest one with the biggest share was the United Health Group with 12.3% market share based on the revenue, basically. And you remember how to calculate the market share, and also at the state level, a few large sellers, basically there are only a few large sellers, and we can calculate the market power by HHI index, and we find that the HHI is greater than 2,500 in 83% of metropolitan statistical areas, which basically indicates that the private health insurance industry in the United States enjoys market power, is highly concentrated, basically is oligopoly, right? So we have, based on that list of the characteristics, we talked about the size, number, and market share. Let's go to the type of the health insurers. The private health insurance industry today basically accounts for 34% of all healthcare expenditure, and as you know, provides coverage for where 2/3 of the population. Is very pluralistic. There are so many different types of health plan providers. which they basically offer subscribers a choice of um, um, among traditional plans and various types of managed care plans. Um, so many of they may actually specialize in either group or individual health insurance or both. So, and we talk about what is the difference between group and health insurance, um, individual health insurance. So there are different types of them. They could be for profit and not for profit entities. Um, so let's look at the types of health insurers. A health insurance mandate is either an employer or individual mandate to obtain private health insurance instead of or in addition to a national health insurance plans. So this is basically a kind of international um, definition by Austin and Hungerford. So um, in the United States, a health insurance mandate requires that an insurance company or a health plan covers specific benefits, um, basically determine the healthcare providers and for the patient populations, um, kind of uh, they have restrictions, the patient population have restrictions for the types of benefits and type of the providers and services they can actually choose. The same thing for healthcare providers. There are some restrictions to prescribe the type of services and treatment for the patients. So the dictation is very restrict for most of the health insurance. Depends on the type of insurance, of course. Um, the health insurance mandate may result in inefficiency if the people are required to purchase additional coverage for which basically marginal benefit are less than marginal cost. If the market is not working well and the people feel insecure, they may actually over purchase different types of health insurance, um, and that actually creates inefficiency in the market. Um, because in that case, the marginal cost exceeds the marginal benefit, and if the cost of state mandates are not justified by their benefits, therefore, this is basically inefficiency in the market. Um, the individual health insurance market may be less competitive than the group health insurance market because of two reasons. So we have two types basically: groups health insurance and individual health insurance. And first, price discounts are easier to negotiate when the policy is for a pool of potential subscribers rather than an individual, right? So basically, we are talking about bargaining to get a better price. The second reason is the agent representing group of potential subscribers are likely to be more knowledgeable and in a better position to make informed choices than individual when negotiating with the insurance companies. This is because of the they're basically the big one, the big insurance or group insurance. They can afford to hire knowledgeable expert basically to actually decrease the price because of the having more information, full information. So here we are trying to figure out, the type of health insurance could be as an individual or as a group, and sometimes some people they have both individual and group insurance, and that basically creates inefficiency in the market. So remember that always anything based on these characteristics, we can determine if the market is acting in an efficient market or not, and double insuring, if the people are double purchasing their insurance, this creates inefficiency. Now, the other factors, characteristics we have to consider whether the market have a market power or not, and industry has a market power or not, is the barrier to entry. Let's look at the empirical evidence. So far we noticed that health insurance may basically we have a market power. They have a market power in basically, and we wanted to know why there is a market power, why the new competitors cannot enter to the market. So if health insurers may face an incentive to behave efficiently, basically if they face a threat from potential competitors, means that if there is no barrier for the other competitors to enter to the market, so therefore the current insurers, health insurers, if they feel that if they don't increase their quality of work and decrease the price, excuse me, if the current actually health insurers may face so that actually no barriers to enter to the market creates incentive for the current insurers in the market to behave efficiently if they face a basically competition in the market. So that's why always it's good to decrease the barriers to enter to the market. And we wanted to know what are the barriers to enter to market. What happened? The current basically industry has a market power. Let's investigate the barriers into the market. The first barrier, as you learned in the previous chapters, in the industry is the scale economies. The scale economies exist when the average total cost of providing insurance coverage decreases as the firm provides coverage for larger group of people, right? We say that as the number of the people increase, the average total cost decrease. So here, if the existing firm with the large number of the basically subscriber customers can basically afford to have a low price compared to the new firms are entering to the market. So therefore, basically, this discouraged the new firms to come to enter to the market to compete with the already health insurers in the market, because the other health insurers in the market, they have a lower average total cost, and the new firms, they cannot compete with the previous firms in the market. So Blair et al. Find that there is a substantial economies of scale exists in the administration of the health insurance. Yet, then in the next study, by using the survival analysis, they find no scale economies in the provision of the health insurance. So basically, they had two studies back to back. The first one, they find there is a scale economies, and the second one, using the survivor analysis, they find no scale economies that exist in the health insurance. So basically, they said that so they, based on the empirical study, that we have kind of like a contradiction in the results. It may be the cost advantage and advantages and insurers basically reap through administrative economies of scale are offset by these economies in other functions such as risk bearing and marketing. So in total, basically the empirical studies don't show any scale economies in the health insurers basically industry by increasing the number of the output. So let's go to the next characteristics, consumer information based on the basically brand names and advertising. maybe actually intra-industry mobility barriers. Basically the existing insurers company, maybe they're trying to, by advertising and brand naming, to make their services different, heterogeneous than, so that makes actually keeping their loyal customers, and makes difficult for the new companies to come and compete with these brand names already existed insurers company in the market. And the other reason could be the high customers switching costs, that it's basically make another problem for the customers to switch their insurance to the newly basically insurers company in the market. So always remember, the imperfect information may lead to higher prices and lower quality of services for customers. And so that's why if the advertisement can actually manipulate the customers to show their product and services is different than the other product, they can actually kind of get some market power for their own brand product or services. In summary, from the structural perspectives, based on all those characteristics, so why the health insurance industry is non-competitive and has a market power? Because we find that the existence of a small number of large health insurance firms and a competitive fringe also hints at an oligopolistic market structure. So we have a small number of the insurers company with a large market share, right? Then we find, although barriers to enter in the health insurance industry are low based on the scale economies, it is not easy for the smaller firms in the competitive fringe to enter the dominant share of the industry. So because of maybe imperfect information in the health insurance industry, that reduces the competitiveness of the industry. And this is due to branding and advertising undertaken by the large firms, as well as non-trivial buyer switching costs, which basically makes difficult for the new companies, new insurers companies to enter to the market and compete with the existed insurers company to make them to basically increase the quality of their services and decrease their prices.